My name is Jennifer Gatsi. I'm originally from Zimbabwe, but I live in Namibia. I'm a woman living with HIV for the past 22 years now. And I still remember when I got tested in 1990, we didn't have any medication at all. And I thought my life was finished. I was dead. It's because from 1990, I think to about 2003, I saw the horrors of the horrors. People dying like flies. But once the global funds started to come into our countries, we started to see the declining of deaths. We started to see cemeteries not packed as they used to be, that you had to make appointments to book for, to bury a relative. I saw mothers with babies in their hands dying in their hands. My pledge and my appeal is to say to the Global Fund, please, this is not the time to leave. We still need you so that we don't go back to what we experienced before you came into the countries.
My name is Abosede Oladayo, and I'm from Nigeria. And I'm a person living with HIV, and I also am an advocate and an activist for treatment. Access to treatment is still a major problem, major issue in the community where I come from in Nigeria. At the grassroots level where I work with women living with HIV, I also work with children who are infected and affected by HIV. I want to live for cure. I want to live for cure. And so are many children who are born with HIV. I want to see them live for cure. And hopefully, cure will come out from somewhere. One day, we just take one step at a time. So I'll say thank you to Global Fund, because I know Global Fund is doing a lot, and advocacy and activism is not all about me. It's all about thousands and millions of people living with HIV out there.
Hi, my name is Aina and I'm from Ukraine. In our region, in a region of Eastern Europe and Central Asia, and in Ukraine particularly, only 23% of people who need IRT actually receive it. It's one of the worst coverages with antiretroviral treatment in the whole world. We do trust in donors, and we do need donor money to continue to be present in Ukraine so we can continue our fight against epidemics, because we know that treatment not only works as treatment, but treatment also works as prevention, which has been already proven by the scientific world.
My name is Nachibuka Maxensia. I was tested and found to be positive in 1998. Then it was followed by the death of my husband in 1999. In 2005, my CD4 went as low as 88 because I had no job. I had no food for my children. I had no income. I was sick. It was PEPFAR Fund and Global Fund through Kamucha Christian Caring Community that I started ARVs in 2006. Since then, my life has been progressing so well. What did I do? I chose to be part of the activism to end HIV. And I offered my own premises to have a clinic. And for the past 6 years, myself and 56 caregivers have every day volunteered to do this. And we are so grateful to the Global Fund that has supported us all this time around. And we still cry to you, Global Fund, to give us much more support so that you can save more lives, and then we can kick AIDS out of the whole world together.
My name is Lynne Kibuchi. I come from Kenya. Kenya is one of the countries that are in the list of high burden countries in the world. We are having quite a huge number of people who are infected with the drug-resistant strain of TB. And I must say that all the TB patients, all the multi-drug resistant TB that we're having in Kenya, they are on treatment thanks to Global Fund. I cannot imagine what would happen if Global Fund was to stop funding the TB control program. I urge the supporters of Global Fund, please just keep on supporting the TB control in Kenya.
My name is Rosemary Mburu. I am from Kenya. Growing up, my experience was that there was this disease that everyone really feared and which equaled death. I also remember watching my aunt and my cousin suffer with HIV to a point of death. And that was a time where you couldn't even speak about HIV. And at that time, there was no hope, really. There was no hope because people just used to die. But then with entry of treatment, then there was some hope. But the treatment was really, really expensive. Basically, you'd have to sell everything in your home to afford the treatment. And so with the coming in of Global Fund and availing the treatment, then I think that really was the lights at the end of the tunnel. And therefore, really those experiences form my memory in terms of where we've come from, what treatment has done, and why we should continue ensuring that we put money in the Global Fund.
My name is Lynne Lackey. I was fortunate in 2002 to 2004 to be a Fulbright Fellow at the University of Swaziland. At that time, there were no antiretrovirals publicly available in Swaziland. My students, who became familiar with me, would tell me that they could see what was happening all around them, that their friends would graduate, and shortly thereafter they'd become sick, and many of them were dying. And the Global Fund brought antiretrovirals to the public sector in Swaziland, and there was hope and a change of mind of many of those people who are alive today.
My name is Aina Sheetheni. I came from Namibia. I have lost 2 of my brothers due to HIV and AIDS. They didn't get treatment, or they were supposed to get it, but because we are far from hospitals, it was delayed, therefore they have to die. The community itself, we are staying in the village, which is far from town. Therefore, all of the people are suffering to go to the hospitals to get treatment. Most of the people are just suffering, either to TB, either to HIV, and the malaria also is higher in Namibia. Therefore, I think if the world can help, like a global fund, so that the people can get their treatment near or in the village, it can help, and I will like it.
My name is Fatou Gaye. I'm from Gambia. I'm living positive for the past 18 years ago. And I have a son with 11 years old, which is negative because of the nevirapine. And my life has improved because of the treatment and many people that I'm leading countrywide. As a national network coordinating 10 groups countrywide in the Gambia, many people living with HIV, their lives has improved because of the Global Fund, and we really appreciate the funding, and our recommendation is Global Fund continue funding because of its saving many people's lives around the world.
My name is Linda Mafu, and I'm from South Africa. We were looking at young people losing their parents, young people losing their brothers and sisters, and we're also losing our brothers and sisters. The change has come as a result of our government being able to buy treatment, This was supported by Global Fund, and we are now seeing our brothers and sisters living longer and really a fulfilled life.
My name is Yvonne Chaka from South Africa. As a UNICEF and Rollback Malaria Goodwill Ambassador, I've traveled the continent. But what is good is that I've seen change. I've seen hope. This is not the time to stop. We need you to be there for our children, for our women, for our people. We cannot put the brakes now. This is not the time. We need a fully funded global fund.